My name is Alyssa Murphy, and I was diagnosed with stage 3 rectal cancer when I was 36. It was December of 2006 that I was first diagnosed, and I started with some rectal bleeding, which I got into the GI pretty much within a couple days. My GI said he did an external exam, and he said everything felt okay, but he said, you know, Alyssa, we really don't know. We won't be able to determine this until we do a colonoscopy. And fortunately, he got me in the next morning, to do a colonoscopy. And when I came out of, having my colonoscopy done, he was shocked, and I could tell by his face that it wasn't good. That he said, in 2 days, we're going to be doing a biopsy in 2 days. We'll be able to determine whether or not it's cancer. So at that point, I was shocked. I felt fine. I didn't feel sick outside of the rectal bleeding, which was unusual for me. I felt fine. Now, I did know that we had a family history of colon cancer on both sides. Initially, after the diagnosis, I actually was sent to a colorectal surgeon. The colorectal surgeon was actually brought in while I was having my colonoscopy. Obviously, the GI, with what he saw, he knew that it was cancer. The diagnosis was given by a colorectal surgeon. The treatment options that were available at the time were the open surgery or the minimally invasive surgery. I knew with the laparoscopic procedure that generally the recovery time is much shorter. I was in the hospital for about 5 days and felt good, when I left the hospital. And the recovery time, within a couple weeks, I was feeling pretty much back to normal. So as far as, having that option to do this procedure, laparoscopically and minimally invasive, I was just thrilled to have that option. My recovery was about 5 weeks, and within those 5 weeks after that, I was feeling good. After those 5 weeks, though, that was also time that I needed to rest prior to pretty invasive chemotherapy, which was 6 months. So basically, the whole procedure starting, I had chemoradiation initially for 30 days, and then followed by my surgery, followed by a 6-month chemotherapy, followed by a final surgery to reverse my ileostomy. So it was about a year total as far as treatments. And I would say within a couple months after that year, probably like 4 to 5 months, I started feeling, back to normal again. As far as with the surgery, I was just shocked at how well I felt after the surgery. That was very surprising to me. I knew it was a major procedure, but the fact that, they could operate laparoscopically, I have a pretty minimal scar, 4 to 5 inches horizontally, whereas if, I would have had the open surgery, it would have been from my breastbone all the way to my pelvic region, something they referred to as the zipper. So, 4 to 5 inch horizontal scar versus that was, I thought, just incredible. Anyone that's 50 years or older, definitely get your colonoscopy if you haven't already gotten one. If you have a family history, please, check with your physician, but generally guidelines are 40 years, to get your colonoscopy. That's really the only way, that you can determine whether or not you have a polyp or a cancer. And this cancer is so preventable that, it's just, people need to get screened, especially if they have a family history. If you are diagnosed with colorectal cancer, keep your spirits up. This is a highly curable cancer, especially if it's detected in early stages. And, though the road may be a long road of a year of treatments and everything, I can attest that, 3 years later, your life can be back to normal.